Welcome to the update from the American Thoracic Society ATS 2024 conference. Here is the therapy update on COPD and pulmonary infection. Effect of triple inhaled therapy with budesonide, glycopyrrolate, formoterol fumarate on cardiopulmonary events in chronic obstructive pulmonary disease. A post-hoc analysis of ethos. Dave Singh from University of Manchester presented that COPD patients face heightened risks of cardiopulmonary events, including exacerbations. In their ethos study, triple therapy with budesonide, glycopyrrolate, formoterol fumarate (BGF) showed promise in mitigating these risks compared to dual therapies with glycopyrrolate, formoterol fumarate (GFF), or budesonide, formoterol fumarate (BFF). BGF 320 demonstrated significant risk reduction across cardiopulmonary and traditional endpoints compared to GFF in COPD patients. He emphasized BGF 320 exhibited notable efficacy in reducing a range of cardiopulmonary outcomes beyond traditional COPD endpoints, highlighting its potential benefit in improving outcomes for patients with moderate to very severe COPD. Reduced risk of mortality for COPD patients associated with initiation of treatment with single inhaler triple therapy, budesonide, glycopyrrolate, formoterol, versus multiple inhaler triple therapy in the United States. The Mazzi study. M. Pollack suggested by Mazzi study that single inhaler triple therapy, SITT, reduces mortality compared to dual bronchodilator therapy. He emphasized that BGF therapy significantly reduces all-cause mortality in COPD patients compared to multiple inhaler triple therapy, MITT, highlighting its potential for better patient outcomes in real-world settings. Effectiveness of budesonide, glycopyrrolate, formoterol fumarate in Chinese patients with chronic obstructive pulmonary disease. Yangcheng Sun delivered results of real-world data for budesonide, glycopyrrolate, formoterol fumarate (BGF) in Chinese COPD patients. He said after starting BGF, the COPD assessment test, CAT, and St. George's Respiratory Questionnaire, SGRQ, scores improved significantly. BGF treatment significantly improved quality of life for COPD patients over 12 weeks. Sanofi pulmonary infection, a randomized clinical trial comparing rifampin plus ethambutol plus either clarithromycin or moxifloxacin. The CAMAMI study. Claire Andrejak presented the outcomes of the study, which compared rifampin and ethambutol combined with clarithromycin, CLA, or moxifloxacin, MXF, for treating Mycobacterium Sanofi, MX, pulmonary infections. He said the results of CAMAMI study showed similar efficacy, 93.2% for CLA versus 82.1% for MXF, and tolerability between the regimens. Intermittent versus daily treatment for non-cavitary nodular bronchiectatic Mycobacteria avium complex lung disease with rifampicin, ethambutol, and clarithromycin. An open-label, multicenter, randomized controlled trial. Kohei Fujita presented a study that compared intermittent versus daily treatment for Mycobacterium avium complex lung disease. He said daily therapy, comprising clarithromycin 800 mg, rifampicin 450 mg, and ethambutol 15 mg, max 750 mg daily, showed a more favorable change in physical health-related quality of life compared to intermittent therapy, which involved clarithromycin 1000 mg, rifampicin 600 mg, and ethambutol 25 mg, max 1000 mg, thrice weekly.